The first method of treating wounds was described over 5,000 years ago. The basic principles of cleaning and dressing wounds have stayed essentially the same, but modern wound treatment has come a long way from its rudimentary beginnings. Today, modern wound care facilities such as Washington Center for Wound Healing and Hyperbaric Medicine provide highly trained specialists, sophisticated technology, innovative treatment methods, and newly developed materials that lead to significantly improved outcomes for patients suffering from chronic, non-healing wounds. Hi, I'm Cheri Sabraw. Welcome to the Washington Center for Wound Healing and Hyperbaric Medicine, located at 39141 Civic Center Drive in Fremont, a short distance from the hospital. A chronic wound is defined as an injury to living tissue that does not show any progress of healing for at least 30 days. The Washington Center for Wound Healing and Hyperbaric Medicine specializes in advanced treatment of these wounds to provide a level of care beyond what a primary care physician can offer. Here to talk to us today about the center is Robert Marks Nichols, manager of the Washington Center for Wound Healing and Hyperbaric Medicine.
The Wound Care Center here specifically has people who come in with wounds that won't heal, and it's our job to make sure that we get them on that process of healing. Here at the Wound Healing Center, we have the extra training, we have everything that's necessary as far as supplies, we have hyperbaric oxygen, we have advanced therapies. So a lot of those wounds that we'll see here will be your diabetic wounds, pressure ulcers, venous wounds, arterial wounds, and then there's a whole category of kind of miscellaneous wounds.
The wound care professionals work closely with the patient's primary care physician to ensure everyone is aware of the treatment plan details and the progress. That's one of the reasons the center recommends a referral from the primary doctor. Typically, there are 4 steps to caring for chronic wound sufferers at the center: investigation of wound history and causes, debridement, the removal of dead tissue and dressing, rebuilding of wounded tissue and skin substitute application, monitoring of the healing process. With us is Dr. Prasad Kilaru, Medical Director of the Washington Center for Wound Healing and Hyperbaric Medicine.
We're happy to treat any patient that has a wound, and I tell my referring physicians, if you have a patient that has a wound for whatever reason, we'll be happy to take care of them. But the majority of our patients fall into 3 categories. Those that have wounds related to circulation, this could be either problems with the arterial circulation or problems with the venous circulation. Those that have wounds related to bed sores or pressure ulcers, and those patients that have wounds related to diabetes. We have many treatment options available depending on what the needs of the patient are. The dressings that we provide for the wound depend on the nature of the wound. Nowadays, we use a lot of tissue that's derived from human placenta, and that's been shown to increase the healing rate significantly compared to standard dressings that we use. So if the standard therapies don't work, we essentially have a ladder that we progress on depending on which works and how they're responding to the treatment.
All of our nurses are wound certified, so they go through special courses to make sure that they understand wounds and what is the latest as far as dressings and techniques that are necessary to heal. Physicians do the same type of thing. Since we are an interdisciplinary team, we'll have multiple different physicians and they will have different specialties, but when they come here to the Wound Care Center, we consider them wound care specialists. So they might be a vascular surgeon, but their real focus here is going to be wound specialty.
All of the nurses at the Washington Center for Wound Healing and Hyperbaric Medicine have specialized training and advanced certification specific to wound care. With us today is wound care nurse Kelly Van, who has been treating chronic wound patients for over 9 years.
With the first visit, it's hard for the patient because they're overwhelmed and they're very anxious. They don't know what to expect, and that's what we're here for. We go over everything in detail with the patients. It's kind of like a family. We get to see them every week. It's a comfort place for the patients. They feel welcome, they can convey the concern, and they know that we are here for them. Not just the wound care, but overall.
This is the center's individual hyperbaric oxygen chamber. And here to explain the process and take us through a typical session is Hyperbaric Safety Coordinator Paul Brown.
How Hyperbaric works is atmospheric air is basically 79% nitrogen, 21% oxygen. So right now you're breathing 21% oxygen. Placing somebody inside the hyperbaric chamber and pressurizing the inside, we use 100% oxygen. So we're increasing the amount of oxygen that you're breathing, which then increases the amount of oxygen that goes into your lungs and then into the bloodstream. So we're causing new blood vessels to grow into that area, getting oxygenated blood to those damaged areas, oxygen to those damaged cells, those damaged tissues, and it's going to help it to start to heal.
I stepped on a glass while working. It was a small cut. The experience with chamber was after a week or 2 weeks once I started coming out, and I see my foot started getting better. The way my wound was, it was horrible, and I didn't have any hope until, coming in here, started going through all the process. And I would recommend for anybody who's scared, just come in and check it out. Because of this, it's all better now. They saved my foot because of that.
You can see a wonderful transition in patients here at the Washington Center for Wound Healing and Hyperbaric Medicine. A person usually comes in unhappy and uncomfortable, but after starting treatment here, their spirits are lifted considerably as they observe the improving results and move toward healing.
Oh, it looks better.
Every day a patient comes to us and they're fearful that they're not going to be able to heal this wound. And by the time they leave each visit, they're one step closer to healing, and the happiness in their face is it's so evident. The way they carry themselves is so evident. The way they talk about the healing process and that they're part of the team, it's just exhilarating to the entire team.
When I first learned that I had a chronic wound, I was pretty upset that it came back, and when I came here, I knew I was going to be taken care of. The staff and I, we have a close relationship. They treat me like family, basically. If it wasn't for this center, my wound would have gotten worse, and this place has healed me up.
As we've seen, the Washington Center for Wound Healing and Hyperbaric Medicine is a state-of-the-art wound care facility, staffed by specially trained experts in the field who are committed to providing the best outcomes for patients with chronic wounds. It's another example of Washington Hospital's patient-first ethic. To make an appointment with the Washington Center for Wound Healing and Hyperbaric Medicine, call 510-248-1520. You can learn more about the center by visiting our website at whhs.com/wound.